asked specifically to also children under 10 are supposed to be isolated at home. Now obviously it's going to be very difficult, for the elderly who go for morning walks, for children particularly who can't now go out to play. What is your advice?
Yes, because it's now well known. See, we are talking about something about which we are still uncertain about some bit of scientific information. But given the scenario in the other countries and what little we know about this, yes, the elderly and the children, especially in our country, again I go back to the children who are anemic and malnourished, so they are more vulnerable than children in more affluent countries, and also elderly who probably have undiagnosed diabetes or even diabetic or heart disease. They are extra vulnerable. Despite the age, there is some other additional, even 40, 45, 50 years, there are many in the country who have diabetes and cardiovascular diseases, so they are vulnerable. Coming to women's health space, in pregnancy, there is a good news for the pregnant women. It's still not known that COVID-19 predisposes to a miscarriage. They are unlikely to have any birth defects, and they are also unlikely to have a premature labor. Having said this, there are some advisories for breastfeeding. It is better that the mother wears a mask so that the droplet infection doesn't cross over to the baby. Non-pregnant women, yes, again the age group and the comorbidities, what we call the associated problems that they may have, like malnourished, diabetes, etc., will add salt on the wound. That's where they have to be careful. So in general, the younger ones also need to be careful because they are the ones who are giving it to the others. So overall caution is a wise thing to do.
Right. We're also being joined by Dr. Ruby Makhija. She's a medical practitioner, but she's also the secretary of a resident welfare association in South Delhi. Dr. Makhija, I'd like to ask you, how important is it really for communication